ECMOs, LVADs, heart transplants. The sickest heart patients in the world are all too familiar with these terms. And our next guest joining us specializes in both of these tools. And the life-saving transplants that give the most dire cardiac patients a second chance at life. Please join me in welcoming the Surgical Director for RWJBarnabas Health's Heart Transplant Program, Dr. Margarita Camacho. Thank you, Doctor, so much for joining us.
Oh, it's my pleasure. Thank you.
So, Doc, tell us, RWJBarnabas Health, home of the top transplant program in the country. Can you tell us about the program and the work that you do as the leading cardiothoracic surgeon?
So the Heart Transplant Program at New York Beth Israel Medical Center within RWJBarnabas Health began in the mid-late 80s. It grew because of an amazing team to be the second largest heart transplant program in the country several years ago, and continues to be one of the largest and most successful heart transplant programs. But that's because I've often said it takes a village to maintain a heart transplant program. It's because of people with a passion, and I have to say the people I work with have that passion, and they are at the top of their game. And they're from numerous specialties, from the transplant coordinators, the nurses, the cardiac operating room team, the social workers, the nutritionists, the pharmacists, physical rehab people, the physicians. It really takes a tremendous number of people who are not only passionate, as I mentioned, but dedicated. So many times, because we're a large program, we've had to call people in who weren't even on call. But if we pick up the phone and we call them, they will often drop what they're doing and come right in, because they really feel privileged to be able to give that life-saving gift to someone.
You said the program started in the 80s.
Yes.
I can't imagine the changes that have happened since. A total turnaround, I'm sure. Mm-hmm. And what innovative programs and work has the transplant program, are they doing now to continue that on?
Well, about 15 years or so ago, we were involved in a clinical trial with another regional program, heart transplant program, and looked at reducing the immunosuppression from dual to monotherapy, because many patients were on dual therapy. And we found out after looking at our 10-year outcomes that it actually was acceptable. So in select patients, we actually go down to monotherapy, meaning one drug instead of two. Because as you may or may not know, the immunosuppression can have side effects that are serious. So in select patients, they were able to go down to monotherapy. Also, several years ago, we were one of the original 7 programs that trialed a heart perfusion device that enabled the heart to continue beating while it was being transported from the donor hospital to New York Beth Israel. It cut down on what we call the ischemic time, which is the time that the heart is not beating, which is a time when the heart is potentially exposed to some damage of the muscle cells. So we're able, theoretically, to travel longer distances using this perfusion device. It will, I am told, likely be FDA approved at the end of the year. So we're pretty excited about that. And with the advances that we've had to make in telemedicine because of COVID last year, we've realized that telehealth visits are actually appropriate in certain cases. So if we need to follow up patients that we follow up routinely, we can alternate telemedicine visits with in-person visits, and that is great for patients for many reasons. It's so much more convenient for them that they don't have to come in and be seen every single time. And you know what? A lot of patients are actually able to keep those appointments because they're telemedicine appointments.
Yeah.
And so, it's all about doing whatever we can do to promote them taking better care of themselves.
I think that's incredible. Like, you would think that telehealth would be for people with, minor things that would go on, but you actually use it for people who have had transplants.
Yeah, we can, and beforehand. So, in the event that they can't make an appointment rather than break it, we'd at least rather have a telehealth appointment, and then they come in for their next appointment. Also, we have always treated a broader scope of patients. We were one of the earlier programs that transplanted patients with amyloid. There are certain, this is a disease that can affect your whole body, but there are certain variations of it that really just affect the heart. And so we were one of the, like I said, earlier programs that treated patients with amyloid. And also we treat patients that are older. We transplant patients that are older sometimes, which, usually only the larger programs tend to do.
Dr. Camacho, other than heart transplant programs that you have, what other transplant programs exist at RWJBarnabas Health?
Well, so we're the home to the only lung transplant program in the state. We have 2 heart transplant programs in the system. We have 2 kidney pancreas transplant programs in the system, and also do bone marrow transplant.
You're busy.
Our system is very busy.
Yeah, well, I know you're busy as well. And can you tell us a little bit about what your day is like and what you go through and the things that you do for others so they can learn?
We start our day, our routine day at 7 a.m. Every morning with multidisciplinary rounds in the open heart unit. And when I say multidisciplinary, there are anywhere from 20 to 25 people on those rounds. Physicians,
so you're the group of people that walk into the room.
Yes, it's a very large group of people. And that's important because I think the delivery of integrated care is critical for many of the patients, in particular, the heart transplant patients. Because as I mentioned, it's a multidisciplinary specialty. And so after the rounds, if there are any operations, those are usually scheduled operations. For example, the implant of mechanical heart pumps, those are usually scheduled. Heart transplants are not scheduled, they're emergencies. So we leave a lot of our days, the transplant surgeons, open for the possibility of a transplant. If we don't have a transplant on that particular day, we will take care of protocols, programmatic issues. We also have scheduled meetings, clinical meetings. For example, our most important meeting as a transplant program is the weekly selection meeting where we sit down as a group, and there are at least 30 people who attend that meeting. Again, multidisciplinary, multi-specialty. Because at that meeting, we discuss potential recipients that are appropriate for listing or being placed on the waiting list. That is a very big decision that involves the multiple specialties. And so before each of our meetings, we receive a very thorough, comprehensive summary of each potential patient being considered for transplant. We meet as a group, discuss all the aspects of that patient, and then decide by consensus whether they're appropriate to be placed on the transplant list or not.
It's good to have that group.
Yes.
Get good feedback.
Oh, it's very important. It's very important because our responsibility as a transplant program is to allocate the organ to the patient that will use it best, have the longest survival, expected survival, and have a good quality of life. And so all those aspects are extremely important in making that decision. And hence the reason for having so many people at the meeting.
Doc, yesterday we had an opportunity to see a video of a live kidney transplant. And I understand you do something similar to that.
Yeah, so I was just about to say that the rest of the day is not uncommonly spent with education. We teach all sorts of students, from high school students all the way up to residents and fellows in training. We have a program with St. Joseph's Medical Center where a third-year general surgery resident comes and does a formal 1-month rotation on the heart transplant service. We also, and this is one of the highlights of my career, we also participate in the Live from Surgery program at the Liberty Science Center. I think I'm entering my 8th year with the center. Every 2 weeks, I lecture to high school students. We talk about organ donation, transplant, the mechanical heart pumps, basically the surgical treatment of heart failure. They ask the best questions. They're motivated. They're inspiring. We show them, since heart transplants are not, we can't schedule them. We show them videos of heart transplants and the mechanical heart pump implants. And I have to tell you, it's been, like I said, 7, 8 years. I still get questions I've never been asked before. It's an incredibly amazing group of high school students, and they're from all over. In fact, one year I lectured to, I believe, 200 high school students in China virtually. So I came in. This was before COVID. I came in at 7 p.m. I was lecturing to 200 Chinese high school. It was one of the best experiences. Really, I
can imagine what the kids would. First of all, how they react to what they see.
Yes.
And to actually have it within themselves to formulate a question and ask it. Yeah. You think that high school kids would be a little bit shy or maybe just, hide their face a little bit?
I think nowadays with the availability of all the technical stuff they have, the internet, I think, one of the good things is I think that enables them to satisfy a lot of their questions. The fact that they're so inquisitive, because after all, that's a seed of learning, right? Is curiosity. And it's just wonderful to see this in them. So now, during the COVID era, we did our every 2-week lectures virtually. We still do them virtually, but I believe we might go back to in-person in the fall. But one of the advantages of virtually, and we'll probably have a hybrid, meaning some virtual, some not. With the virtual, we're able to include school groups from all over the country. Mm-hmm. So we've had groups from the Midwest and from the South as well.
So yeah, we won't be getting necessarily rid of the virtual, but using it as an add-on to everything else that we do to reach more people.
That's right.
That's amazing. Doctor, you work with so many patients. But what's your favorite part about working with the transplant recipient and their families?
One of the aspects of it that I feel really privileged in helping with is helping them on this very sometimes difficult journey. Mm-hmm. So one of the things that got me really interested in heart failure surgery is that I was able to help people who were at the end of the line, who didn't really just need a cosmetic surgery or whatever, something simple fixed, but people who really knew that if they didn't have a heart transplant, it would be over, sometimes sooner than later. We've had to treat people who were literally dying on our list and who wound up getting a heart within hours to days, to people who can wait months to years. But for all of them, it's one of the most important journeys of their lives. And to be able to make this happen for them and to support them, not just medically, but emotionally, I think is one of the most incredible gifts we could give, as a healthcare community, as a transplant program. And so that is the part that I enjoy, that I feel I can help make that big difference.
I've seen that difference. I know someone. Byron, I know you're probably watching right now. And I think about him often. He had an LVAD. Mm-hmm. And now he has a heart. And we know he's doing well. And it's incredible what you and your team does. Again, it's not just local anymore.
Right.
It's something where you teach nationwide and worldwide, mm-hmm. so that others can do the same thing, which is, I think, fantastic. And these games are there to spread that mission, and to show how people come together because of it, mm-hmm. but at the same time to continue to spread the word and have those conversations. Why are the transplant games so important to RWJBarnabas?
Well, so RWJBarnabas Health has a mission of keeping people as healthy as possible, and they have incredibly comprehensive programs put together in all specialties to help. Transplant is definitely one of the most comprehensive programs in the system. All the transplant programs, and so it takes a huge infrastructure to make a transplant happen. So to be able to see that patients not only are doing well, but are willing to sort of send the message out to the rest of the world that they care, that they want to make the most of this second chance they've had, is so rewarding to us, to the system. And I do think that is one of the principal reasons our system truly supports these transplant games.
It's incredible to see what happens when someone gets a transplant, and to see their energy, their fervor for life. Like, they just live different, and there's a different type of appreciation, and all that, of course, is only possible because of the donors.
Right.
And today we celebrate those donor families. We remember the donors, and without them, none of this is possible. And without you and your team, none of this is possible. And they all get to participate now. They get to be together. Why is it important to you? Because I know it is. Why is it important that your transplant recipients and their families continue to participate in these types of games?
For two main reasons. Number one is I think that it's important for them to keep trying to achieve their personal best. And I think that this is really a message to themselves, to their families, to everyone involved in this process of transplant games, to show that they really do care and they do really appreciate that second chance. And I think, secondly, it is their way to honor the donor and the donor families for the precious gift that they got. So, it's just inspiring to know that these games, continue to happen, and they continue to bring this community together so we can celebrate that.
Most definitely. Shout out to Bill Ryan. He definitely makes these games happen year in and year out. Dr. Camacho, thank you for joining us, for sharing stories, for teaching us, and continuing to teach those who will one day carry that torch and continue on this great work that you do as we celebrate today all the donors, all the donor families, on behalf of them all.
Thank you
Doc.
so much.
Appreciate it.
Thank you.
We've got more good stuff. Stay with us.